piles or hemorrhoids, they are a very common problem, and they are in fact the most common disease of this anorectal area, and they come under the benign category of diseases. So piles is in normal language, if we try to understand them, it is a swollen blood vessel in the anorectal area. And when the blood vessels in this area they get swollen up, they tend to bleed with motion when we try to pass motion, or we have a hard stool coming up. So the first symptom of the piles is painless bleeding. Like suppose one day you go to freshen up and you find fresh blood in the toilet. So you should have this doubt coming in that I might be suffering from hemorrhoids. So it is very important that we don't wait for the pain to happen and we contact the proctologist as early as possible. So piles, they are a benign condition and they are categorized into 4 stages, and the stages are grade 1 to 4. So the first 2 stages of piles, they are absolutely curable by simple measures as we can just take care of our lifestyle, we eat right and we stay right, and we take some herbal medicines or some cure for it, and you don't need surgery. But when the piles they progress to grade 3 and grade 4, they require some surgical intervention. So the surgical options for this category of piles can be laser or stapler. So that depends on person to person, how many is the number of the piles and what is the grade of the piles. Piles develop in our body because of many conditions. So there are many factors which are responsible, like if you have a long-standing constipation, or if it is in your genes, genetic as we may call, or one might be having some liver problem or some anorectal problem which is responsible for hard stools or straining for long. So you might develop piles. When a patient of hemorrhoids or piles walks into our department, we do a thorough clinical examination which is done by the doctor, and we do a small scopy which is known as proctoscopy. So we insert a small scope inside the anorectal area and we try to differentiate the category of the piles. So as we categorize them into grades, we can give the patient the options like grade 1 and 2 can be treated conservatively, or the patient can just follow a good lifestyle and take some medicines for few couple of months and the patient can walk away right. But if you have advanced stage of piles like grade 3 and grade 4, you might be requiring surgery. So the surgical options are now minimal invasive, and we give the option of laser or stapler surgery to such patients. If the surgery has done in the right manner, it is very difficult for the piles to come back again, of course, but the person has to follow a very strict lifestyle, a healthy lifestyle, and as per the literature, and if we do the procedure right, there are no chances of happening the problem again for 10 years or so. The investigations required for a patient of hemorrhoids are very simple, that include starts with a thorough clinical examination of the patients, and then it is followed by colonoscopy wherein a flexible pipe is introduced inside the anus, and we have a thorough check of the big intestine, the colon, the rectum and the anal area. And this is a very specialized test which is done by an expert which is trained in doing the scopies, and this is followed by the blood investigations which would include a complete blood count and tests for the liver and kidney functions as well as for the heart functions. The advantage of minimal invasive surgery in the field of proctology is that you don't get wounds like the old days. So using the conventional surgeries in the older era, when the hemorrhoids were taken out through conventional means, it would lead to wounds. So nowadays we do this procedure with laser and with stapler. So both the techniques will not give you wounds. So the surgery has been simplified and the patient can walk away the same day.